Mr. Sandman, bring me a dream.
So I am Valerie Ing. I'm a sleep medicine physician. I work in Clackamas, Oregon at Mount Scott ENT and Sleep Medicine, and I'm here to talk with you a little bit about sleep. A brief outline. So first, we're going to talk a little bit about the complexity of sleep. We'll talk about what happens during sleep. We'll talk about the effects of caffeine and alcohol and sleep deprivation, and then we'll talk a little bit about some suggestions or recommendations to help improve your sleep. So as a sleep physician, I often get patients who come to me and they say, I'm really just not sleeping well. And the first question that I generally ask them is, well, what's your expectation of sleep? And that's because patients frequently will say, well, my spouse or my friend is able to fall asleep whenever they want. They go right to sleep and they sleep the whole night. They never wake up. And that's awesome for that patient. But much more commonly, it takes people 20 to 30 minutes to fall asleep. Sleep disruption or waking up at night can be a normal phenomenon as long as there's not something like sleep apnea contributing. And if you don't time your sleep the same each day, then you're going to struggle with sleep even more. And so these are all very common issues. And that's because our sleep is strongly tied to our circadian rhythm. So our circadian rhythm is our body's clock. It's our body's ability to know where to put sleep. And it does much more than that. But as a sleep physician, I worry about the sleep portion. And our circadian rhythm's one of the strongest factors that drives our body's ability to know where to put sleep is light. And so what we do during the day, our routines, our work schedules, all contribute to your brain's structure and where to put sleep. And sleep is complex. I mean, the reality is that we have many parts of our brain, many nuclei that interact with many neurotransmitters. And these neurotransmitters help us to either stay awake or stay asleep. And in order to transition from wake to sleep, you have to turn off the wake and turn on the sleep. Now, our brains are wired for wake. And if you think about it from a safety perspective, that makes sense. It's safe for us to be awake when we're driving and safe for us to be awake when we're on an active call or working. And so in order to sleep, we need to be able to turn off all of these neurotransmitters before we can initiate sleep. So frequently when patients come to me with a difficult time falling to sleep, it's not that they have a hard time turning their sleep on. They're sleepy. It's that they're having a hard time turning their wake off. When they do research, so at Stanford in 2011, their sleep disorder clinic took their basketball team and they said, we're going to make sleep a priority for this team, and we're going to see if this affects their performance. And it did. The people who were able to extend their sleep, they had better shooting accuracy. They were faster. They weren't as sleepy. They had better scores on mood scales. Their psychomotor vigilance was better. These people performed better when they prioritized sleep. We know that the sleep you get before and after learning is important. So if you go to learn something new and you haven't got a good night's sleep before, you're going to have a hard time consolidating that memory. And if you learn something, even after a good night's sleep, but you sleep deprive yourself the next night, you're going to have a hard time consolidating that memory. And that's because sleep plays a vital function in memory consolidation. This slide, I think, is especially important for you all because of your 24-hour shifts. So this was a study done comparing cognitive performance during a 24-hour period of wake without allowing any sleep. And so we know from many studies that right when people wake up, so that very first bullet point here, right when someone wakes up, we're not the smartest. There's a lot of fogginess, a lot of sleep inertia, and we don't perform as well cognitively. But shortly after, we reach our baseline cognitive performance. And during the morning hours, we reach one of our peaks. People perform well in the morning hours cognitively. And we all have an afternoon slump. That after lunch tiredness, grogginess that you feel is part of your circadian rhythm. That's normal to have that grogginess. And you can even see that people don't perform as well after lunch. It's not because of the food, it's because of your circadian rhythm. And after that afternoon slump, people tend to have a second wind. They perform better, alertness improves before bedtime. And then if you keep people awake, you don't let them sleep, these are people that didn't nap at all, and you reach that nighttime, period, their cognition and cognitive performance declines. People don't, they're not as fast in their decision making, they're not as accurate in their decision making. And this is important for you when you're trying to decide if you should finish playing that game of Sudoku or Candy Crush on your phone or the conversation with your friend versus going and laying down and trying to take a nap during your shift. Because if you don't prioritize sleep and you're trying to just reach an expectation of being able to be awake for 24 hours straight without sleep, you're not going to perform as well, especially during those nighttime hours. In fact, we know that if you test cognition and you compare it to people who are doing the same tests with different blood alcohol content, we know that after about 17 hours awake, you perform like somebody who has a blood alcohol content of 0.05%. So this would be like saying it's acceptable on your 24-hour shift to have a beer at lunch, and we're going to just accept that you're not as sharp or as accurate for that afternoon period, and that would never be okay. But for some reason, we don't require any napping prior to this 17-hour mark, and we accept that people aren't going to perform as well. And this is where it's really important to prioritize sleep during a 24-hour shift. I frequently get questions about caffeine and alcohol, so I'll just touch briefly upon those two. So caffeine affects your sleep. Caffeine essentially, when we were talking about all of these neurotransmitters for wake and sleep, adenosine is a neurotransmitter that drives your sleep. And when you drink coffee, you lower the amount of adenosine, so you become more alert. And it's great to use strategically, but if you use it before bed, it is going to affect your sleep at night. No matter what people say, it's going to affect your sleep at night. You're going to have different stages of sleep when you do sleep. And we know that caffeine 6 hours prior to your bedtime typically results in about an hour less of sleep. So it's important to use caffeine strategically, knowing that the half-life is variable depending on your genetics and the amount of caffeine you drink. About 3 to 7 hours is what we typically predict, and trying to avoid it 6 hours before bedtime. I see many patients who tell me that when they drink alcohol at night, they sleep better. And part of that's true. When you drink alcohol before you go to bed, you fall asleep faster. We know that. But the stages of sleep that you should move through at night are kind of backwards. And in that second half of the night, you wake up more. And that's often why people don't feel as good when they drink before they go to bed, especially if they have a little too much to drink. They don't feel well in the morning, because the alcohol has a direct impact on your sleep, despite the fact that you may fall asleep faster. Everyone metabolizes alcohol differently, and the wake-ups in your second half of the night are often because when we have any alcohol, our body still goes through a little withdrawal. Even one drink, your body still goes through a little withdrawal after that beverage has been metabolized. And so yes, spacing it out as far from bed as you can should be helpful, but everyone metabolizes it differently, so it really is kind of a personal experience. But you do end up having what's called REM rebound. As you withdraw from alcohol, your brain's been deprived of REM sleep in that first half of your night, that you have a lot of REM sleep in the second part of your night. But we don't like messing with our sleep stages. We don't like people taking things that messes with your brain's ability to go through its typical sleep stages at night. And I'm not saying don't ever drink alcohol. It's just something to think about when you're trying to look at your sleep patterns. So next we'll talk about sleep deprivation. There's short-term and long-term effects of not getting enough sleep. And the most common thing you'll feel is sleepiness, right? If you don't get enough sleep, you're going to feel tired. But it's not just the amount of sleep that you get that affects how tired you feel. So it does play a role. So not getting enough sleep, we call it insufficient sleep, is going to make you feel sleepy. But also, let's say you're able to get 7 or 8 hours of sleep, but someone wakes you up every hour, or you're getting a call every 30 minutes. Well, even though you might have accumulated a good amount of sleep, you're still going to feel sleepy because your sleep was disrupted. We know that your circadian rhythm plays a role in your sleep and how you feel about your sleep. So if your brain's been trained to go to bed at 10 p.m. each night, and then you're going to work a shift and you try to go to bed earlier or later, even though you might be able to make a good amount of sleep in that off time, it's not in your brain's typical period of sleep and you're going to feel sleepier. And then primary sleep disorders. So if you have sleep apnea and you're not using your CPAP during your sleep or whatever treatment you use for sleep apnea, then you're going to feel sleepier. That sleep goes from restful sleep with your CPAP to not restful sleep or unhealthy sleep without the CPAP. And this includes even naps. So if you're trying to gather a 20 or 30-minute nap during downtime at work and you don't put your machine on, well, your body's suffocating intermittently during that time because your airway's closing, and then you're going to feel sleepier. So it would make sense to extrapolate to, you have all of this trauma at work, you don't have recovery sleep, and now you're trying to comprehend the trauma from the night and you're sleep deprived. And it would make sense to think that mood outcomes would be worse. I don't know the primary data surrounding that, and I would be shocked if it wasn't studied, especially in the VA population, but it would make sense. It's biologically plausible that if you don't get enough sleep following these events, your mood is going to be impacted. So another thing that we frequently see in people not getting enough sleep is drowsy driving. And I'm sure you've all experienced it after a 24-hour shift where you drive home and when you get there, you don't remember the drive. Because your brain was so sleepy, it was probably micro-sleeping the entire drive, which isn't safe. If that happens and you get home and you don't remember your drive, that should make you think, wow, I was really sleepy and maybe I shouldn't have driven without a brief nap at least beforehand. Because we know, the last CDC estimates were about 6,000 fatal crashes in just a year because of drowsy driving. And these are just the fatal crashes. These aren't any crashes, fatal crashes. There's many more injury crashes or non-injury crashes above this. But drowsy driving is a real problem. We know that when you don't get enough sleep, you have more stress. And when you have more stress, it also leads to not getting enough sleep. And it's not just the stress that you feel, but also your stress hormones. They can actually check your blood levels. I mean, we don't do it to our patients, but subjects in studies, they can check their levels of stress hormones after they haven't gotten enough sleep, and you make more stress hormones. So the body is experiencing more stress, not just mental stress, but physical stress because you haven't gotten enough sleep. But I think it's important for you all to realize the long-term effects of not getting enough sleep. And I frequently see first responders, even firefighters who've retired. And they come back to me and they say, I've retired, and at least if they haven't gained a bunch of weight, they're off their blood pressure medicine, their health is better, their sleep is better, they feel better. And we know that this chronic sleep deprivation could have led to a lot of these issues. So one of the things that we see is increased mortality, at least in men. We see more high blood pressure and diabetes. And high blood pressure and diabetes is something that's frequently brought up in other studies. High blood pressure, more diabetes. We know not getting enough sleep affects these things. We also see more dementia. And people who chronically get less than 5 hours of sleep at night, we see higher rates of dementia. And lastly, we see more tumor formation. There's a tie of chronic sleep deprivation and more cancers. Next, we'll talk a little bit about what to do, some general recommendations and some specific things you guys could consider based upon your shift. And the first thing I always tell patients is that for our brain, for our circadian rhythm, we need to aim to keep our sleep times consistent, which means going to bed and waking up at the same time as much as you can, and sufficient. So at least 7 hours of sleep, but oftentimes people need more. Some general recommendations we talk about with our patients is shutting down electronics 30 to 60 minutes before bed. And I oftentimes hear patients say, yeah, I've heard that, but I really like to do this before I go to bed, or this helps me relax. And what I talk with them about is the light exposure. If you remember when we talked about circadian rhythms just a little while ago, one of the strongest triggers for your brain to know where to put your sleep is light. And light turns on wake. It stimulates wake in the brain. So when you're looking at a phone or a tablet or watching a show before bed, your brain is getting light and it thinks it's sunlight. It thinks it's daytime, even if it's not. And what that's doing is it's turning on your wake. It's making your wake in your brain stimulated, and it's saying it's time to be awake because there's light. And then you shut off that light, and you, for some reason, expect the wake to shut right off, but it won't, because it's been told the sun's up. I'm getting light hitting my retina, and the sun's up. I need to stay awake. And so that screen time before bed is not just because, we don't like people to be able to watch their favorite show before bed. It's because you're getting the light exposure, and that light exposure affects your brain's ability to shut off the wake when it should. We know that we should try to create a strong tie of sleep in your bed. Little babies, we try to do this by putting them in their crib when they're drowsy, and we want them to associate their crib with sleep so that you can put the baby in the crib and they'll sleep all night. And our brains, even as adults, need that strong association. So if you're doing other things in your bed, you're reading, you're on your phone, you're paying bills, you're watching movies, your brain is associating your bed as a cozy, nice place to be awake. And hopefully we all have cozy, comfortable beds, and we want our brains to want to go to sleep when we hit that bed. But if you're spending time awake in your bed, your brain is breaking that association of sleep in bed. And that's why we recommend that you should keep your bed as a place for sleep and sex only, and really limit awake time in bed as much as you can. We talked about caffeine and avoiding caffeine after about noon. We talked a little bit about sleep opportunity. We aim for at least 7 hours of sleep per night, at least, and so making sure that you have enough opportunity for sleep. So when the show's on that you want to watch and it's creeping up to your bedtime, you've really got to have some self-control in turning it off so that you're not going to bed late, not only for your circadian rhythm, so that your brain knows when it's your bedtime, but also because we want you to have enough time to sleep. We know keeping the schedule as regular as possible is important, and that's hard because of the way you guys do shifts, and any shift workers work their shifts, but as consistent as possible is important. And then not checking the clock at night. When we check our clocks at night, we get light exposure, our brains start thinking about the time, and people tend to have a harder time turning back off that wake stimulus and going back to sleep. We know our bedrooms should be a little cooler temperature. It's different for each person, but typically a little cooler is better for most patients. We know it should be dark. And if you're a shift worker and you're trying to sleep during the day, you've got to find a way to make your room dark. Either wearing blackout shades over your face or actually having blackout shades or curtain on the windows. But it's very important to have it be dark. And I know you get home tired and you don't care if it's light, you're going to fall asleep. But you're going to have a harder time sleeping as long as you should to make up for your sleep deprivation if the light's coming in. So it's important to prepare for that sleep by making sure the space you're going to sleep in is dark. And then quiet and comfortable is important as well. So shift work in general, whether this be somebody who just works intermittent swinger night shifts or somebody who works these long shifts like you, I always tell people plan for your shift. Have a plan for what you're going to do for your sleep in order to try to avoid sleep deprivation. So this isn't just recovery sleep. This is sleep before and during your shift. And there should be a plan. Obviously, your job's unpredictable, but you should at least come into it with a plan and a goal so that you're making priorities during your shift and even before your shift to help with this. And for people who are chronically sleep deprived, people who maybe have a harder time sleeping at night, sometimes even a nap the day before your shift is far before your sleep time can be helpful, because then you're not showing up to your shift with sleep debt. You're not showing up sleep deprived. Strategic napping is important. Being aware of light exposure is important, like we talked about. And then again, consistency in your schedule. So when we talk about naps, these are naps that are not happening during your shift. During your shift, we're trying to capture as much sleep as we can, but the naps before your shift, the typical nap duration that's recommended is less than 20 minutes, 10 to 15 minutes, but less than 20 minutes. And these are naps that happen as far from your sleep as possible. So this would be, days preparing for your shift. This would be the day before your shift, and you're thinking, gosh, I didn't sleep so well last night. I'm going to try to get enough sleep tonight. Well, you might try taking a 15-minute nap after lunch on that day prior to your shift. Typically, naps that are that short don't affect your ability to fall asleep at night. If it does, that's something to consider. But for most people, they'll be able to take a brief, short nap and still fall asleep at night, as long as the nap is far from your bedtime and short. So a couple more little tidbits of knowledge that I find really help patients when they're thinking about their sleep. One is social jet lag. So I typically explain this, and I use an example of people who work typical kind of Monday to Friday, 8 to 5 shifts, which I know isn't what you guys do, but it'll help understand the concept. So these are people who alter their sleep times on their weekends, who stay up later, who sleep in more, and then they feel fatigue during the first part of their work week. And that's because, let's say during their work week, they're sleeping 10 p.m. to 6 a.m. And their circadian rhythm, their brain gets on this pattern, and it knows that around 10 p.m. we're going to turn off our wake and turn on our sleep. And around 6 a.m. we're going to be awake. And then it gets towards the weekend, and you decide to stay up later. So let's say this patient, their circadian rhythm is set on this 10 p.m. to 6 a.m. schedule. And then Friday night, you decide to stay up till midnight. And then you sleep in. And you feel okay Saturday morning. You still got 8 hours of sleep. You feel all right. Saturday night, maybe you do the same thing. You stay up late. You sleep in. Well, in those 2 days, your circadian rhythm, your brain has tried to adjust to this new schedule. You can adjust by about an hour a day. So now come Sunday, your brain's thinking you're in a different time zone. Bedtime's midnight to 8 a.m. And so then you lay down to sleep Sunday night before you go to work Monday at 10 p.m. and it takes you 2 hours to fall asleep. And you finally fall asleep closer to midnight, because that's when your brain has felt is going to be your bedtime, because it's trying to predict in real time. And you sleep and you wake up at 6 and you feel terrible. Not only because you've gotten only 6 hours of sleep, but also because you're waking up during your brain's circadian time for sleep. And the brain wanted to sleep until 8. So you get to work, you drink your coffee, and you feel exhausted. And Monday night, Tuesday night, you're trying to shift back to the sleep at 10 and waking up at 6, and you finally get there. You maybe feel better Thursday and Friday at work because you got back on your sleep routine, only to do the same thing the next weekend. And we call this social jet lag. And people don't feel well when they do this. When they alter their sleep times, they don't feel well because your brain is constantly trying to play catch up. And we even know that people who do this, we see more heart disease. We know daylight savings time, we see more heart disease because these shifts in your sleep time aren't good for your brain. And the other little tidbit I'll talk about before I do a quick summary is paradoxical insomnia. It's my favorite type of insomnia. This is people who come to see me and they say, I only sleep 2 hours a night, but I can't really nap during the day. These are people whose experience of sleep doesn't totally line up with the way that they're feeling. And oftentimes this is associated with a lot of checking the clock at night. And the thing about paradoxical insomnia or sleep in general is that you really can't remember falling to sleep. We have a little amnesia about falling to sleep. So if you've ever sat by somebody watching TV and they sleep, they start snoring, they're asleep. And then they wake up and you say, hey man, you were just snoring, you were asleep. And they say, no, I wasn't, I was watching this. Well, that's a perfect example of paradoxical insomnia. They didn't remember falling to sleep. They didn't really remember waking up, but they were certainly capturing some sleep. I mean, you were hearing them snore. And this is a common feature in paradoxical insomnia. One of my mentors, he gives this example of him sleeping at home, and he woke up in the middle of the night, and he checked the clock, and it was midnight. And he's kind of frustrated, right? When we check the clock, it's frustrating. It's never a good thing, it's always a bad thing. You check the clock, and you're disappointed it's the middle of the night, or you're disappointed it's morning already. So he checked the clock, and he felt stressed about his sleep. And he was frustrated. He had a lot to do the next day, and he closed his eyes trying to go back to sleep. And the next thing he knows, his wife turned the lights on. And he was a sleep doctor. He knows that light's bad for you at night. And he was so mad at her. And he opened his eyes and his wife was sleeping next to him and the sun had come up. And he would swear no more than 10 minutes passed. But he had fallen asleep because, the next thing you know, the sun was up. So he had slept, until 6 in that morning. But he didn't feel rested. He didn't feel good about his sleep. He had paradoxical insomnia that night. And if we were to take away the clock from this scenario, people tend to feel better. So if we replay the scenario and we don't let him check the clock, let's say he set an alarm for 6 a.m., but he didn't have access to a clock. Well, he would have woken up. We all know it would have been midnight, but he wouldn't have known. He would have been like, my alarm hasn't gone off. I should go back to sleep, and he would have closed his eyes. And the next thing he would have known, the sun came up. His experience of sleep would have been better. And because of that, he probably would have felt more rested that day. He might have thought, I wonder if I woke up at 5 in the morning. He wouldn't know. And maybe he felt like he only got 10 more minutes of sleep, but then the sun was up, and that's okay. And so removing the clock at night is very important. We'll do a quick summary and then some thoughts to consider, and I'll answer questions. Again, the same things in like a broken record. So enough sleep, consistency, no electronics, bed for just sleep and sex without a clock that you can see at night. Obviously you have to set an alarm for the morning. And then short naps. So some thoughts that I had when thinking about your schedule particular, one of them is sleep diaries. So everyone hesitates to do sleep diaries, but sleep diaries can be very, very helpful. I attached a link here of a common sleep diary that I have patients fill out, but it doesn't have to be this link. This would be just for your benefit, filling out a diary of your sleep. And when we do sleep diaries, they're estimates because we don't want you checking the clock. So this would be after a nap, you'd kind of think, I think I fell asleep around 1 and probably slept for a half an hour. And then at night, I think I fell asleep around 11. I was up around 1 probably. And then I think I probably woke up around 4. And then I got up in the morning at 8. And so you'd shade in your time of sleep. And you would do this throughout your work week. For a few weeks or maybe even a month. And you would get a lot of amazing data to look at. Because then you could sit there, you could compare with your colleagues, and you could figure out why some weeks you were able to make up more sleep than others, with the same amount of shifts. And did something work better for you than another? And find the weeks that you're able to get more sleep, and then talk with your family about it. Talk with your family about the effects of sleep deprivation and how you need to find a way to get sleep, and find something that works for them too, because a lot of your quality of life has to do with what happens at home after your shift too. And so you got to find a way that works for you and your family to capture that sleep. And if you're just kind of guessing what happens during typical shifts, you're going to have a lot of recall bias and fluctuation because your shifts are variable. The amount of call that you get's variable. The stress of the shift's variable. And so having some data to actually look at in order to implement some changes in your personal schedule is very important. Shift timing. So, I went to a lecture when I was in my sleep fellowship about firefighters in Portland, and they were looking at different types of shift schedules. And it was mainly researchers there. But a group of us, physicians were leaving, and we had this little conversation about, gosh, it's interesting that there's all this thought in timing or in timing and spacing between shifts, but no one's really looking at what time you start work and end work. Because we have these circadian rhythms, could you time things better or differently and test it out to see if it helps people get more sleep during their shift so there's less sleep debt at home? So that might be something to think about. And then workplace culture. So I see a lot of patients who come to me and they're sleep deprived. They work shift work and long shifts. And they say, I know I should be napping at work, but every time I have downtime, I have things to do. We all do, right? We all have our lists. And not just work-related things, but home-related things. They're on their downtime, but they maybe need to pay some bills or do things that are typical, adult responsibilities. And they're not prioritizing sleep over those. When I was a hospital doctor, before I was a sleep doctor, I worked a lot of nights. And I would get emails from the hospital system saying, you got to do this training, it's due next week. And I'd be up at night doing an online training on cultural diversity, which is important, but I should have been sleeping. I was up during my circadian night, and it was important for my brain to get sleep, but my workplace culture made it so my expectation was to be awake for the full 12, 16-hour shift. And so addressing cultural issues in the workplace is important. And prioritizing maybe in the afternoon slump, in your 1 to 2 p.m., should we dim the lights at work? And have the expectation that everyone tries to lay down, whether they're sleepy or not, and tries to capture some sleep so that you perform better during your long shift. And thinking about those cultural changes in the workplace that can help to prioritize sleep. And that concludes everything that I brought to talk to you about. So thank you for having me here to talk about the coolest field of medicine, which is sleep medicine. And I am available for any questions, even if it's about your sleep apnea and your CPAP. I'm ready. I don't know. Yeah, so the question is about, do I know of any organization who's actually studied or tested these theories of changing shift times or prioritizing sleep during certain times? And I don't. In fact, when I was talking with other sleep docs, some of which are circadian rhythm researchers as well, they didn't either. So this, as far as I know, would be something new to think about, though I haven't done a primary literature review to see. Yeah. So is there a set of food or specific diets that helps and hinder sleep? Some patients are affected by things that cause heartburn at night, we know. So tomatoes, tomato sauces, chocolate, mint, things like that that make more reflux at night can certainly impact your sleep. And I'm sure there's been some research on does one diet or another maybe promote sleep, but nothing that has been profound enough for me to recommend to my patients. Yeah. I have lots of thoughts of melatonin. So melatonin is something that your brain naturally secretes, and it's one of the sleep hormones that's important. And melatonin actually starts being secreted hours before your body's circadian time for sleep. And so melatonin can be used strategically. But the hard part about melatonin is that everyone secretes melatonin a little differently. And it's based upon kind of your baseline sleep. So, they'll take subjects, and put them in a sleep lab with continuous, intermittent blood draws, and they'll find their exact timing that maybe taking melatonin would help with their sleep. So it's hard to make recommendations about melatonin and sleep with fluctuating shifts. Some people take melatonin as what's called a hypnotic, which is a higher dose of melatonin, usually 3 to 5 milligrams at bedtime, and they typically feel like it helps them to sleep. And each sleep doctor has their own feelings on melatonin. So you're going to get a different answer depending on who you talk to. Strategically using melatonin for things like delayed or advanced sleep phase, which are circadian rhythm disorders, is clear-cut. But in shift workers, it's not as clear-cut. What I generally tell my patients is that if you're taking melatonin and you feel like it's helping you, some of that might be placebo effect, but if you feel like it's helping you, it's probably one of the lower risk things that you could do and take for sleep. So I don't encourage it, but I don't discourage it as long as patients are feeling like it's helping them at night. For people who chronically get a lot of sleep or long sleepers, more than 9-10 hours of sleep, some studies show that there's risk associated with getting too much sleep. And these are people who do this all the time. This isn't making up sleep debt. And so we do know that there's some risk associated with that. If I recall right, the last statement from the American Academy of Sleep Medicine, they didn't set an upper limit on their recommendation. They said 7 or more hours. And so though we do think, there could be some risk to these people who chronically are getting a lot of sleep, the recommendation at this point is, more than 7 hours. And so typically I'll talk with patients about this if they're somebody who really likes their 9.5 hours of sleep and they feel rested with 9.5 hours of sleep. We make sure they don't have sleep apnea contributing to sleepiness that might be causing them to have so much sleepiness they're making more sleep. And then it's just a discussion about some of the risks of long sleep versus their personal benefits. And most people who are long sleepers, 9-10 hours of sleep, who feel great with that amount of sleep, they decide, hey, I feel better with this, and they continue that despite some risk. So the question is, do I have any recommendations of a vitamin regimen that may help with this, constant release of stress hormone at night? And I don't. I think it really gets down to your routine. Making sure you're getting some exercise, making sure you're prioritizing sleep. But there's no vitamin regimen that we recommend for people who have these, stressful jobs, at least from the field of sleep medicine that I know of. Eating healthy is important. Most people can get most of their vitamin intake by just simply eating healthy. But other than getting the sleep there's no pill that kind of reverses that effect of not getting the sleep you need. The question is, do I have any advice for when you get the call, you have the rush, the adrenaline rush of the call, and then the call's canceled? Any way to help with that? And I would probably say, you should find some type of decompression method. So a lot of people use guided meditation. There's apps that you can turn on and play as you're laying down to fall back to sleep. Sometimes you may need a little decompression outside of your bed. You might need to go out, have a quick chat with your colleagues, kind of recover and go back to bed. But that's tough. I remember being a hospitalist and going to codes, quick codes that ended quickly, and trying to go back to sleep after something like that's very stressful. So having a little bit of a decompression and a plan. This is where the plan comes in. You got to have a routine for what do I do when this happens, and how do I get back to being able to fall asleep.